Thank you, Mr. Chairman. General Josephs, welcome up here. Hey, my first question is about the Veteran Real Estate Tax Exemption Program. Okay, if you could answer just a couple questions about that, about how many veterans have, disabled veterans have applied for the tax exemption, but also one of our concerns is that there have been serious delays in the processing of the applications. Can you tell us what's being done to try to speed that up? I understand at times it can be as much as 8 to 10 months to process an application.
Yes, sir, and thanks for that question. Our veterans are near and dear to not only General Beck, myself, but the governor as well. Every request that we had in our budget for veterans were approved by this governor's budget. We sincerely hope that the legislature will feel the same way about that and approve them. In that budget, we asked for and received 3 additional personnel to support that particular benefit on the real estate exemption. There is normally about an 8 to 10 month wait because at the time we only have 1 individual assigned to do that. In addition, General Beck asked his key staff, including himself, many weekends I would walk into DMVA building and find the senior staff working on these particular grants. So hopefully with the budget that gets passed, we'll have those 3 additional individuals to assist in providing that. And General Beck could expand on the number that applied for it. I believe it's a little over 8,000.
Yes, sir. It's 8,127 to this point, and that's considerably more than when the program started, which it started at 3,000. So 1 person has been working it ever since the program started, and that's what's got us up to now, where we're at about a 10-month delay. I think we're putting a chunk into that delay now with the kind of work we're doing, and I know that the additional 3 people that's in the budget, if we were to get that, it would help significantly, because this not only affects us, but it affects the veterans in a bad way, because they're trying to get their taxes paid and counting on getting that tax exemption, and then it takes us that long to process the tax exemption for them. So the idea is to get this thing through in no more than 90 days in the processing.
Yeah. Thank you, General Beck. I have House Bill, I've introduced this year, House Bill 602. What it would do is increase the per diem rate for the state active duty National Guard soldiers from $75 to $100 per day on their per diem. They haven't had a pay increase on their state per diem rate for almost 15 years now, is what we can go back to. If that were to pass before this budget, what kind of an impact would it have on your current budget?
Well, first, sir, we thank you for that initiation of the bill, because it'll bring our soldiers and airmen at least up to minimum wage when they're right. On a state active duty mission. When we pay in state active duty, normally it's in conjunction with a federal type declared emergency. If we do get a federally declared emergency, that will normally reimburse the state 75% of whatever their costs are. So we don't really see an impact on the budget at this time.
Okay. Can you tell us what's being done to help veterans who are homeless or unemployed? But I guess the biggest crisis facing our veterans today is the suicide rate of our veterans who've come home from Iraq and Afghanistan is something like 22 veterans per day that we're losing. I've said, you know, if we were losing that many people in the correction system, I can tell you that politicians would be running around declaring a state of emergency, but we're losing 22 veterans a day to suicide. And I know I've seen Congressman Toomey or Senator Toomey and Casey have worked on issues, but what are you doing, and what can we do to help you bring that that number down to hopefully 0?
Sir, and that would be a goal of all of us to try and do that. We believe that the latest statistics are bringing it down from 22 per day to 18. It's going in the right direction, but it's still 18 too many. Some of what you have already done helps us out. With your educational benefits and benefits that go to support our family systems for outreach, that certainly helps. The most recent educational benefit to give incentives to doctors, medical professionals, and especially those that are in a mental health field, for those that work in the Guard, will work a yeoman's effort to try and help us retain those people within the Pennsylvania National Guard. And I believe Colonel Ferraro may end up being able to expand on some of the family programs that we have within the Pennsylvania National Guard.
Yes, sir. Sir,
If you can pull that microphone to you.
we currently run a resilience, risk reduction, and suicide prevention program within the National Guard, which is federally funded through the National Guard Bureau, through DOD. We run numerous types of events, not just for our service members, but for our families. And we partner with local and county community outreach services to support our soldier members, not just in suicide prevention, but also in substance abuse and resiliency skills that will assist them in overcoming some of their issues. We have behavioral health personnel on the staff full-time, both some that wear the uniform and some through a contract. And we also have suicide intervention officers that are trained through a contract from National Guard Bureau in every one of our armories and units, so that when there is a soldier that shows signs of suicide, ideations and whatnot, or substance abuse, those counselors that are trained in the units can intervene immediately and get them the help that they need. And as General Joseph said, with the new medical education incentive, that will allow us to bring our medical professionals up to a level that's sustainable to support the soldiers out and airmen out in the field.
Is that the mental health first aid program that have you embraced that in your department?
Sir, that's on the veteran side.
That's on the, okay.
Yes, sir. We've been collaborating with OMSAS, the Office of Mental Health and Substance Abuse, along with Drug and Alcohol, as a part of the Governor's Advisory Council for Veteran Services, and providing classes for not only veterans to come into, but anybody to come into and get training on mental health first aid and how to identify the signs of a mental health issue. We've been conducting them in the veterans' homes, as well as out in the community across the Commonwealth, and it's supported by DHS. And that's been the biggest driver of any of the programs that we have in support of veterans that are contemplating or appear to be contemplating suicide.
I thank you. If you can keep us informed how the program is working, it would mean a lot to us. And Mr. Chairman, that's all the questions I have. Thank you.